Tell me what. So, are we starting online as well?
Yeah, we're live.
Excellent. And people came here rushed after dinner, so I'm very thankful for that. My name's Jeff Freed, and we're just going to be talking about largely healthcare. Who is in the healthcare track? Is it anybody not in the healthcare track or undecided? And then you guys are figuring out. Okay. So this is really all about healthcare. And I'll be talking about the opportunities and examples in that with what's called FHIR, which is a standard for interoperability in healthcare, and machine learning and other things. In Scotland, to go back a little bit in the pandemic to February, vaccines are coming out in the UK, and the government of Scotland, in fact Lothian, which is the largest state there, finally got their supply and opened up for appointments. And the very first day, they managed to handle 3% of the demand. Because they hadn't thought about, they have a call center that takes 5 minutes to make an appointment, and a whole population of 500,000 people trying to call at once. So they called us, and in 2 weeks we had a system working with them that took all of the patients in that state, made appointments, 2 appointments for them ahead of time, sent them messages saying, you now have an appointment. If you want to change it, here's how you do it. Give them an online system and scheduling and follow-up. 2 weeks. So just take this hackathon and multiply it by 14, and you'll be able to build stuff like that. And I find that really inspiring because it helps people directly, and you can build stuff really, really quickly. So I'm going to offer a couple of resources as we go around. The first is MIT Hacking Medicine, which has also an annual hackathon that's focused specifically on healthcare, which is a great one, but they also have a ton of resources on that site. So if you want to look at things after this hackathon of applications in healthcare, everything from supply chain of, think about masks getting to health or not, that's a great one. And there's a book for folks that don't know about the healthcare industry but are computer scientists that I really recommend, called Hacking Medicine. So it gives you some history of what's really a very complicated industry. I think healthcare is more complicated than almost any other industry because there's so many specialties and so many differences between your situation and my situation. So you have really complex systems. And the third resource is one that we made at InterSystems for the hackathon, which gives you a way to get going quickly, build stuff with patient data, and use it just for the hackathon. And then, I know a number of teams want to go on and take their project and then turn it into maybe a company. So scale up, get into production quality, et cetera. So 3 resources I'd recommend. And that can put you right into the middle of this tsunami. We're at a time that healthcare is really, really changing, and COVID has only sped that up. Nobody imagined 18 months ago that telehealth would be fully accepted, fully paid for, and that about half of the outpatient visits are now remote. Nobody imagined that population health would be this important and this clear for everyone. So if you're interested in being an entrepreneur, the other thing you might want to know is not only can you make the world a better place, but there's a ton of funding. The first half of this year, there was $15 billion in venture funding for health IT in this country. It's bigger than any other segment, and there's a lot. Within about a mile of this place, there's 100 startups that are doing machine learning on healthcare data. So starting your journey here or elsewhere in this field, it's really exciting. Now, as we get going, there are two things that I want you to know about as context, and those two things are about InterSystems and about this thing called FHIR. So let me take you through that. InterSystems, which is a sponsor here, and I work there. We're literally next to the MIT campus, one Memorial Drive next to Sloan School. And we're on our way to being $1 billion company. We work with all of the top names in healthcare. If you go to our website, you'll see, though, that we do other things as well. We run about 15% of the equity trades, as you might have heard this morning from the greeting. We work a lot in manufacturing and supply chain. One of our customers runs 1 billion containers through their shipping. They run a shipping line and on railroads. There's all kinds of interesting things. And we work with a lot of governments, both on healthcare and security, police forces, and increasingly in some parts of the world, these are now getting combined, public health and public safety. We talk a lot about clean and healthy data. And it's because we believe that that is really going to change the world. So let me ask you a quick question. If you take a longer view and say, in the last 150 years, we've doubled life expectancy in this country. What single thing do you think made the biggest difference? Was it penicillin, antibiotics? Was it anesthetics? Was it gene sequencing? X-rays? Any guesses? I can't see the folks online that are guessing, but what? Cigarettes is the biggest advance. It's stopping smoking. Big effect. Yes. Any other? Yeah.
I don't know if maybe it was going too back in time, but were we sterilizing properly back then? Equipment.
So sterilizing it, understanding how to keep clean. That's a really good one. Yeah.
Waste management.
Waste management.
Sewage.
Yeah, that's also a really big one. And I think you are closest to right, because purely having clean water, influenza, the last big thing like COVID, was at a time that most places still didn't have clean water, and that was part of the spread. Or the bubonic plague was all, with clean water. It's a huge difference. So the thesis here is that the next century in healthcare is going to be powered by clean data, just like the last 150 years were made much better with clean water. And we do this at InterSystems every day. Across, healthcare has a big spectrum from what are called providers, those are hospitals and doctors, payers, insurance companies, medical devices, labs, what are called exchanges, and you may or may not recognize some of these names, but these are all customers that are essentially the top, the largest insurer in the largest of the blues. IQVIA runs life sciences labs. It's a lot of fun because we can work across the spectrum with everybody as sort of the Switzerland of a supply chain or an ecosystem where these guys are also competing with each other. And that's what got us into this interoperability of sharing data across all of this so that you can have much better data for treatment, for public health, etc. So that's about InterSystems, and we have a table here. Happy to talk to you more. We're, have a crew for that. The other thing you should
Sorry,
know
before,
about is FHIR. Yes?
sorry, before we move on, we have a question from
Yeah.
the chat. So Anonymous asks, you mentioned that the healthcare sector changed a lot in recent years. How did FHIR and InterSystems change with it?
Great question. So one big change is government forcing the industry to digitize. In this country, I mentioned weird incentives. Hospitals have a disincentive to digitize. They don't want to give their records out because then they might lose their patients, which is their money source. And they pay for these expensive systems, but the benefits go to the insurance companies or the patients. So it took the government stepping in with something called meaningful use to basically give people an incentive. Like it's about $50,000 per doctor if you make meaningful use. And that turns into a stick next decade. And for InterSystems, that's really meant that we work much more across the spectrum. We used to work more only with providers, but now with payers, et cetera, et cetera. The other thing is a change in ownership. You don't own your health record in this country. The hospital owns your record. And that's weird. So that's changing, at least to the effect that you now have the right to your health record free from any hospital, and they must give it to you in this standard called FHIR. And that regulation was supposed to take effect at the end of last year. It got a 6-month grace, so July 1st this year. And that has really changed this adoption of FHIR, and InterSystems has changed with it because we're focused on making this really easy to use for developers. Great question, thank you. So back to FHIR. I'm showing a couple of links here. This is a standard, and it's a pretty strong standard, almost at the level of, let's say, TCP/IP. You can have two people that do a FHIR implementation and they really do talk to each other, which is a first for the healthcare industry. The previous standards have all been very splintered and kind of weak. There's a workshop that my colleague Anton did this afternoon that you can see on YouTube that goes much more into the structure of FHIR. I'm going to really talk about how people use it in these patterns. And really the reason that this as a standard is transforming healthcare, you have to understand in some ways how screwed up things have been. Because I mentioned that it's got screwy incentives, but it's also a splintered industry. There's no vendor in healthcare that has more than 15% share. Unlike, let's say, manufacturing, SAP has 70% share, and Oracle has 20%. So you have these folks that make software for healthcare that are in all kinds of little corners, all competing with each other, and there never was a strong standard. A lot of the standards have been splintered. So this is the first time, that there's a strong standard, and secondly, that it's what you consider as computer scientists, a normal standard. This is all REST. It is all stateless and things you can use normal development tools and normal practices. It's complicated because healthcare is complicated. But it's something you can work with without what has been traditionally a 6-year undergrad plus a graduate degree in health informatics before you can get going. And now there's a certification and a government lab that certifies that your stuff works against these regulations, and there's an open competitive marketplace. So that's why there's so many startups, that's why there's so much venture funding. I love numbers, as you may have seen too. Actually, my favorite number is I. And I'm just going to talk about these 3 numbers for the rest of the time to show 5 patterns that I see of people using FHIR or FHIR and machine learning in the real world. and show you then two examples of pretty early stage companies that we've worked with to do interesting things. This is meant as inspiration. If you're in the middle of a project, maybe there are ideas you can add into your story or even into your software. If not, then think of it for next time. And there's infinite possibilities because the space is so exciting. So the first pattern I'm going to talk about is connecting legacy systems and FHIR together. I mentioned this is a new standard and it's strong and it's great. It's still only about 3% of the traffic in those places. If you walk into a hospital, they have lab systems talking to X-ray machines, talking to MRI machines, talking to their admission systems, talking to the billing systems in these arcane old protocols, which is an alphabet soup. X12 is used and often for billing. DICOM is used for images in these things called PACS, which are picture archiving and communication systems. We're talking mostly about FHIR, but there's a whole lot of alphabet soup that you need to really work in the real world. And a lot of the customers we work with use our software to take these legacy formats and transfer it back and forth and really change, if you will, Portuguese to French to Japanese across these protocols. And I'll highlight one, which is a French company called Gerbe. They make what are called contrast imaging. If you go into, you can go in for heart surgery, and they inject you with a radioactive dye and stick you in a MRI machine, and they watch how the dye goes through your blood system so they can tell where there's constrictions, etc. Traditionally, this has been one size fits all. You get a dose that's a certain size, and that's a bit of a problem because I weigh maybe a little bit more than you do, and twice as much as my wife. And people with certain conditions shouldn't have a lot of radioactive stuff put in their veins. So the innovation for Gerbe was to take this and have a new set of software that now goes with their injectors that connects to the patient record, figures out how much you weigh, what conditions you have, calculates the right dose. It actually makes the images better. It's better for the patients because they don't have this gun put into them all the time. And like somebody with brain cancer would get 10 rounds of this because you get images after every time you have chemotherapy. And they use our software in exactly this way. Convert legacy protocols across the spectrum and make them all speak together. So we have a service called the Message Transformation Service, which is available to you guys. You can use it in 5 minutes. Even my sister can use it. Put data into S3 buckets and transform back and forth with sample data available to do exactly that. Because that is probably the top pattern we see of people that really want to work in the real world in healthcare. The second pattern is what would be, again, normal for you in computer science of developing API first and securely, which is to say that you can now, because FHIR is REST-based, what we've done is published a spider spec, published a browser, published examples, so that the resources, and right now I think there's 133 resources in FHIR, FHIR4. So each of those, a resource would be something like a lab result. So finding your way around this schema is complicated, and we've made that much easier. Third pattern is using machine learning. And they're much like a lot of other industries. In healthcare, I see people struggling either because they're trying to get data science talent, and that's hard to come by. Is anybody here studying data science? Okay. or because once they build a model, they can't get it into production. And once they get it into production, almost nobody monitors where the real action begins, because that now the model is hitting real world data. So 1% of companies do any kind of that ML ops. And that's been a focus for us in a facility called Integrated ML. So if you're a developer, how many are developers? Everybody, okay? That's what you'd expect at a hackathon. You don't need to know the data science to get basic good results. I mean, you're not going to build a self-driving car without a data scientist, but you can get data in, build models, use those results in your application. If you know SQL, you can use it. And there's examples, one with published code, et cetera, on our website for what's called readmissions. When they let you out of the hospital or kick you out of the hospital, if you have to come back, that's bad. If they let you go too early. Hospitals have a big penalty for that because it's bad for patients and it's bad for patients. So this is using machine learning, which turns out to be at least 50% better than the current scores. They're called LACE scores, which are manually done. So you can make a big difference in a simple operation like that of predicting that before you let somebody go, predict whether they're going to come back in 3 days and maybe you want to keep them a little longer. And the other example, someone at this hackathon that is using ML on images like this, but machine learning can do better than people on a variety of tasks, especially the classic thing is breast cancer, because it will pick up tumors at a much smaller size than a radiologist can see, and therefore get intervention at an earlier point. So there's a huge power of using machine learning on images. That's pattern 3. Pattern 4 is working across organizations. There's a group called Da Vinci we're a sponsor of that basically connects between insurance companies, patients, and payers so that, for example, you're getting pre-authorized for a surgical procedure, you don't have to get sent around. If you've ever been through this, it's a pain in the ass, and just making it automatic and easy. And a lot of use cases around that. There's also the 21st Century Cures Act is the one that means that you don't own your patient record, but you have the right to access it at any time now. And there's a thing called SMART, which you can think of as a standard for web apps with webhooks, very simple HTML apps that are very great for providers, physicians, or patients to use this kind of data. So we also have example smart apps if you want to build one for this kind of purpose. We have a customer called RxMX that use this pattern really to help people take their medicine, because people who don't tend to not do very well. And what's called non-adherence. About half of medications aren't taken as prescribed. So anything you can do to make that better makes a big difference. In the US alone, 125,000 deaths a year, and maybe 10% of hospitalizations come from non-adherence in not taking your medicine. And these guys said, we're going to make an app that, especially for specialty medicine, tracks what you're taking, how you should take it, knows your particular health circumstance, and reminds you, and also is used to develop specialty medicines just for a given patient. And it shares data across the labs, across the hospitals, and across the drug companies. using the same kind of technique that I described for FHIR interoperability across them. That's pattern 4. And pattern 5 is adding intelligence to the images, by which I mean you can tag things in x-rays, you can point people through genome patterns, and we have a pattern and resources for that if you're interested in it. We have a customer in Japan called Canon Medical Systems. Actually, they're not just in Japan, they're all over the place. They're in half of the large hospitals in Europe, and they've built a clinical cockpit like this. So you get the images. Often this is tomography slices of your brain, for example, and now you can look around it in 3D, not just in science fiction, but a normal doctor can do that. And it is patient-centric and essentially combines the data that you have from all the sources I talked about and the machine learning algorithm, and lets the physician then guide the machine learning. So very powerful for anything that has image-based tomography and other data. When you get the slides, you'll see listed as 6 different popular standards for medical images. None of them are good for AI. So you have to transform these into what you really want, which is 3D images in sort of raster format. And there's resources for how you do that as well. Had a startup out of China using images from Wuhan to begin with do X-ray classification and CT to detect COVID. And they tried to bring this to market, and people said, well, I've got a test to detect COVID. That's easy. But it actually turns out this ended up finding a good niche in taking COVID patients and looking at the X-rays and detecting and predicting the severity, like what's the patient treatment track based upon these classifiers. So it's using machine learning and classifiers to look at these images and detect patterns that are really bad, the kind of pneumonia patterns that come from COVID. All right, almost done. We've gone through the 5, which are these 5 patterns connecting across systems, across this alphabet soup, and the FHIR, developing with the FHIR in normal development with API management that also lets you control access, bringing machine learning in, spreading it across organizations, and then adding intelligence to those images. I mentioned that I'd also talk about the 2, just picking 2 examples of companies that started at about this stage and that have grown up enough to have a storefront and people, et cetera. One of them is in Belgium, it's called Biosphere, and these guys have built very fast genome and what's called omics. There's a genomics you've heard of, proteomics you may have heard of. There's also several other omics. And the way I describe their approach is rather than sequencing genes and doing a computation around that, which is an NP-complete problem, that is but what everybody does. They transcribe the genes into proteins, and 90% of them wouldn't make viable proteins because the folding doesn't work. So you can reduce the data quite a lot by going across these layers. And they started in a garage and have worked into working software with customers and now funding. The other is a company that's really ultimately turned into a service company that we work with a lot. And we have an open exchange for components And if you actually come out of this hackathon with working software, that might be a good place to get attention for it. And they're using this essentially to get consulting work. Now you can use, I2B2 is a data model used often in research hospitals if you're doing clinical trials. And you can transform the same data into the standard data model that is then exchanged across researchers. The software is great, but also they happen to be experts in I2B2 and they make their money off of consulting. So just to wrap up, healthcare is incredibly exciting and there's a lot of opportunities. We've been living in this space for 42 years as a company, not me personally, but and have worked with basically everybody in the industry. So we can provide a lot of help if you want to build really cool apps for the future of healthcare. We have in the Amazon Marketplace 2 services that I mentioned, one that does this legacy transformation, the other that works and lets you work off FHIR directly. We also have software you can use there as a full database and development environment that also will load into a medical device. So, opportunity here on this front. And I'm really, really interested in seeing what you'll do. Thank you very much. Seems like there's some questions.
Yeah, so we do have to wrap up pretty quickly, but I do want to ask one quick question before we go. I believe this question came in when you were talking about government regulations with FHIR and everything like that.
Yeah.
Someone asked, how does FHIR protects patients' privacy?
So FHIR by itself doesn't do anything to protect people's privacy, but it has to comply with privacy regulations like people have heard of HIPAA. Almost every country has this as well. And there's two main ways you do that, one of which is security, authentication and control. So you can only see certain data, and the other is called consent, that you have to manage. Somebody has to give you permission to use their data, and that has to then map to roles. Technically, authentication and security can get pretty complicated. Usually it's done through OAuth2. We support multiple providers for security. And consent is at one level simpler, but at the other level, something you have to be equally as careful for because it's a legal construct.
Great, thank you so much.
Thank you.
Any last minute questions from live audience? Great,
Thank you
so
very
much.
much. Yes, I can have it.